Good morning, Monday morning here, March the 16th. If you're watching this live or on recording, obviously maybe a different time. Good Monday morning. We're in a situation, as you all know, here in the US and across the world, actually, with a lot of things going on. But I just wanted to quickly get on to let everyone know who might be watching this, to let you know I'll be in office and available for doing what I do. And I'd like to let you know I also am available for telemedicine. So there are a lot of time slots available, being very flexible for the coming weeks ahead and making it easy as possible for both my patients and anyone new who'd like to consult, has health concerns. And those who are my patients and perhaps haven't seen a naturopath before, I just wanted to emphasize a couple of things for myself and my colleagues out in our area and across the globe, really. And that is the field of naturopathic doctors. We are licensed care providers in many of the states in the US and in Canada. And we are primary care providers in some cases, and some of us specialize, just like medical doctors go into different specialties. But the point of telling you this is that many of my patients may not realize that I do provide expertise in basic care in terms of infection and wellness, and other concerns, whether an acute thing. So I'm making myself available, of course, to provide that. And many times I've had patients tell me later that they had been at urgent care going into the ER because of a cold, upper respiratory thing. And I want to help people avoid going into those centers. Of course, as we know, we need to be leaving our medical system for those that are needing the acute care. And I know it may be, we might be apt to being concerned that when we're sick and have a respiratory problem that we need to get urgent care because of all of the panic around the COVID-19. Now, I think out there is enough information about the signs and symptoms, but again, I'll go through them. And again, these medical emergencies should be left for those who are at risk and older adults, especially who are in respiratory distress. If you just feel lousy and you have a fever and you have a cough and a dry cough, as we've seen in the case of COVID-19, it's a little bit unique in most cases in that there's not a lot of mucus production, upper respiratory drainage, and typically not a lot of things like GI distress, and it's more of a dry, kind of a deeper cough that goes into the lung, or again, the fever that comes up. And so anyway, you should call your provider before going in anywhere. So don't try to walk in just to get tested. They are saying they're going to have drive-up facilities available for testing. Those are probably not available, at least in my town yet, but I had heard that some of the larger retailers will be facilitating having some drive-up possibilities. So anyway, the point is, number one, I'm available for consultation for those. My number 509-413-1530, and I'll put that in the description below after I'm done with this video. And again, I would just emphasize, most of the time, many of you are going to be getting normal viral sicknesses, we're still having cold season up here. There's the flu, there's the common cold, and we don't need to assume the worst. Yes, there are cases that are probably in most major cities that are going to distribute. This is a part of nature as well. And it doesn't mean we don't take steps to prevent the spread. I'm in agreement with what's happening, except the level of panic that we're seeing in the population, I think, is unwarranted. And I think it's unfortunate that some of the media outlets and even the medical experts for social media is putting out there these hot pockets of worst case scenario, a lot of calculations on exponential growth, what's going to happen throughout the community. But we need to remember that this happens all the time, both historically in terms of a new and novel virus making its way through the population, and also every season that these viruses mutate and come along. I'm not downplaying the severity. I'm not downplaying the fact that it could impact you or someone you love. but all evidence points to that this is going to be very manageable. Um, Part of the stretch that's happening on the medical systems in these places where there's been outbreaks, whether in the, both in China and in Europe now, in Italy, is that you have a lot of people panicking and rushing into the medical system because of they've got the symptoms and they may very well have COVID-19, but they can't handle everyone with this virus, which in many of these people, it will be self-limiting. They need to isolate themselves. And I've talked about this before, but it's unfortunate in our modern society, we've become so dependent on urgent major medical systems because in the past, mankind has relied on these home remedies and traditions of medicine and self-care, and we have lost that art. Mothers and grandmothers and fathers and grandfathers and families of a village and people who in neighborhoods knew how to provide some palliative care, or I should say ameliorating these symptoms. So um, so a lot of information online. Of course, people can say, well, this is old school medicine that doesn't really work, but it's not really. It's common sense. Things like baths, magnesium salts, Epsom salt baths, herbal remedies, and things that everyone should have in their spice cabinet and in their first aid kit should really be things that can help with the common viral infections that we can all get. Reducing sugar intake, getting more sleep and rest, lots of fluids and tea, hydration, and again, cutting out the sugar. You don't need to drink lots of sugar or be eating a lot of sweet foods, of course, because it suppresses the immune system. So getting a little off track, I wanted to keep this video short, but for those who may come across this video, again, I'm trying to be just simply a calming voice out here, and to let people know that we will get through this, and we're needing to be more isolated, and that makes total sense. So let me know if I can be of help. Comments, questions, let me know. Again, supplement deliveries are coming in, and I'm happy to ship out, drop ship, etc. to you. But you got to communicate with me. Again, 509-413-1530. I'll link that along with email address, website, and other ways to contact me. You can also use YouTube from where you're going to be seeing this video. Also, look up Zalo Living in Spokane. We'll be live streaming. Look up on Facebook primarily. We'll be answering that probably today at noon. Probably say we're going to be doing this every Monday at 12:15. Also Thursdays at 12:15. We're just going to be covering some topics and having some discussions to help you along your way. Talk about the things that are most important in healthcare today. So again, thanks for watching. And I look forward to getting back to normal and helping anyone I can out there.